Vitamin E is a potent ally in the fight against chronic inflammation, a silent but powerful contributor to many modern diseases, including arthritis, cardiovascular disease, metabolic syndrome, and autoimmune disorders. While widely known for its antioxidant capabilities, vitamin E also plays a direct role in regulating inflammatory responses at the cellular level. Inflammation is the body's natural defense mechanism against injury and infection, but when it becomes chronic, triggered by poor diet, environmental toxins, stress, or ongoing immune dysfunction, it begins to damage tissues and accelerate aging and disease progression. Proper supplementation with vitamin E can help interrupt this destructive cycle by reducing inflammatory signaling and oxidative stress simultaneously. One of the key ways vitamin E reduces inflammation is by downregulating the activity of pro-inflammatory cytokines, chemical messengers such as tumor necrosis factor alpha, TNF-A, and interleukin-6 (IL-6), which are elevated in many inflammatory and autoimmune conditions. These molecules trigger immune cells to remain in an activated state, leading to continuous inflammation, swelling, and tissue breakdown. Vitamin E, especially in its alpha-tocopherol form, has been shown to inhibit the expression of these cytokines, helping to calm the immune system without compromising its ability to respond to real threats. This immunomodulatory effect is particularly valuable for individuals suffering from conditions like rheumatoid arthritis or lupus, where the immune system is persistently overactive. Vitamin E's role as an antioxidant further supports its anti-inflammatory action. Oxidative stress and inflammation are tightly linked. Free radicals not only damage tissues directly, but also activate inflammatory pathways. By neutralizing these harmful molecules, vitamin E reduces the cellular signals that perpetuate inflammation. This dual action has been observed in both animal and human studies, where vitamin E supplementation led to measurable decreases in C-reactive protein, CRP, one of the most widely used blood markers of systemic inflammation. Lower CRP levels are associated with a reduced risk of heart attacks, strokes, and other complications related to chronic inflammation. In conditions like osteoarthritis and rheumatoid arthritis, vitamin E may help reduce joint pain, stiffness, and swelling by decreasing oxidative stress in joint tissues and reducing inflammation in the synovial fluid, the lubricating fluid in joints that often becomes inflamed in arthritic diseases. Some small clinical trials have found that patients supplementing with vitamin E reported less pain and improved joint function, particularly when combined with other nutrients like vitamin C, selenium, or omega-3 fatty acids. While vitamin E is not a replacement for standard anti-inflammatory medications, it can be a valuable adjunct in a comprehensive approach to managing these conditions. Vitamin E may also have broader benefits for inflammatory issues throughout the body. In individuals with metabolic syndrome or obesity, conditions often marked by chronic low-grade inflammation, vitamin E has been shown to reduce markers of oxidative stress and inflammatory cytokines. This is important because unchecked inflammation in these states contributes to insulin resistance, liver dysfunction, and increased cardiovascular risk. By improving antioxidant defenses and calming the inflammatory environment, vitamin E supports healthier metabolism and may improve how the body handles glucose and fats. There's also growing interest in how vitamin E might influence inflammation in the brain, particularly in neuroinflammatory conditions like Alzheimer's disease or Parkinson's. In these disorders, chronic inflammation contributes to neuronal damage and cognitive decline. Vitamin E's ability to cross into the central nervous system and reduce oxidative and inflammatory stress in brain tissues could make it a helpful nutrient for long-term neurological health. To support anti-inflammatory benefits, vitamin E should ideally be consumed as part of a balanced diet that includes other synergistic nutrients. Whole foods like almonds, sunflower seeds, spinach, avocados, and olive oil offer not only vitamin E but also fiber, polyphenol, and essential fatty acids that collectively reduce inflammation. When supplementation is needed, especially in individuals with increased oxidative stress or inflammatory disease, care should be taken to stay within recommended levels and to favor natural forms of the vitamin, which are better absorbed and more biologically active. In conclusion, vitamin E plays a crucial role in reducing inflammation by suppressing harmful immune signals, neutralizing free radicals, and supporting the structural integrity of tissues under attack by chronic inflammatory processes. Whether helping ease arthritis symptoms, lowering systemic inflammation in metabolic disorders, or providing protection against inflammation-related aging and disease. Vitamin E stands out as a nutrient with broad and meaningful health benefits. When included thoughtfully as part of a nutrient-dense lifestyle, it helps move the body toward a calmer, more resilient, and less inflamed state.